Hi guys, welcome to Healthy Happy Families with the Natural Parent. I'm Annaliese Jones, Naturopath and Medical Herbalist, and today I'm talking about something that came up as a question, and we're talking about constipation in babies, and particularly during that transition from or to solid food. So it's something that comes up quite a lot for people, and it doesn't mean you're doing anything wrong. You know, babies have a really immature digestive system, and they're really just learning to make digestive enzymes, to do really good peristalsis, which is what pushes that stool along, to make hydrochloric acid. They're completely sterile when they're born in their gut, so there's not even any good gut bugs. So all of that they're starting to populate in those first few days and weeks, and obviously over the months they sort of get better and better at things at digesting as well. So it can happen that when we go from purely having a fluid diet into having more solid foods that need more digesting, that things can slow down. And we do want to help our bubbas with that, because we want to make sure that they are clearing out what their body's trying to get rid of. But there are some quite simple things we can do to help. So there's no need to panic, but it is really worth making sure they're going every day ideally. So for newborns up to 6 months, there are some really simple things you can do. We can obviously change mum's diet. Ideally, we might just start by increasing fluids, perhaps having, a lot of pregnancy tea as well. Make sure that your milk is really abundant so that baby's getting enough fluids. There are some herbs and things you can take to help with that as well, but you might want to seek some professional advice before you do that while you're breastfeeding. But you can get those over-the-counter breastfeeding teas, which are generally really great as well. So you can try that first. The other thing is mum can start to think about maybe some extra kiwi fruit, prunes, pears, things like that in her diet, just to help too. As for directly with baby, you could think about doing some massage. You always want to do it in the clockwise direction, which is the way that we want the stool to be moving. So just gently, some little movements in a clockwise direction around and around. That can be quite helpful, particularly after a bath's a good time. If we're really struggling, we can give a little bit of boiled cooled water to baby. You might want to do it through a syringe, and sometimes that's quite helpful. They just need a little bit of extra fluid, but you really don't want to overdo that. You need to be quite careful about how much you give them. Really, just 5 or 10 mils will be enough to start with for little ones. The other thing that's important is some tummy time. So making sure that they, are getting to stretch out their abdomen. You might want to put them on the floor for tummy time, or if they're a bit young for that, perhaps over your knee is always good, so that you're kind of helping everything to move in that area. And you can also think about probiotics. So it might be that they were born by C-section, or it's a particularly fast delivery. Then in that case, perhaps they haven't got all the gut bugs that they need as far as coming through the birth canal. So when they come through the birth canal, they pick up all mum's gut bugs, and the slower the delivery, they'll be getting them, as they come up and down that canal, they're getting it all in their noses and mouth and in their eyes and ears, all their orifices, and that's actually how they start their population of good microbiota. So if they didn't have that, or if it was a fast delivery, some probiotics are really helpful, and you can get child specific ones or baby specific ones that they can take from birth. For kids that are older and transitioning, like having some food already, you can start to introduce some things directly to them. You could give them some prunes. I would do, half of one a day just to start with. If we're talking like a 6, 7, 8 month old, just start really, really slowly. You could actually also give them some flaxseed, some ground flaxseed, just about half a teaspoon, so not too much. We don't want to overdo it, and half a teaspoon's about enough. And you add that with water and soak it, and then I would also perhaps give them some ground oats. So you just get your oats, and then hopefully organic if you can, and then you just use a stick blender or put them in a food processor so they get really, really fine, and then you could soak that in some water and add the flax seeds to it, and then put it into some food that you're giving them, or just off a spoon if they'll take it that way. Make sure you up their water when you're doing that, so plenty of water will help. If they are having something that's very absorbent. Those like flax seeds, they're particularly mucilaginous, so they get that way by absorbing lots of water from the gut, which is great, but it does also mean that they are needing to up their fluid intake, otherwise they might get a little bit dehydrated, so I would work on that. Obviously, as we just talked about water, making sure they are getting water at that age, we can definitely up their water. We can be giving them some pears as well, giving them some kiwi fruit. So there's lots of ways that you can naturally try to increase their bowel motion. Ideally, 1 to 3 times a day once they're having solids. When they're newborn, it can be, up to a lot more than that, say up to even 5, 6, 7 times a day, and that's perfectly normal as well. If they've gone more than 4 days without going to the toilet, then you definitely need to talk to your midwife. If it's a little E, plunket nurse or GP, you want to check that out. But if it's less than that, or if you've been to your GP and everything seems fine and they're still sluggish, then you can try some of those tips. If you've got any questions, let me know, and just flick me a DM is probably the best way, and I hope you have a really wonderful day. Bye-bye.